There are moments in life when we believe we are doing everything right for our health. And then, out of nowhere, we discover that the very things we trusted might be putting us at risk. Imagine this. You follow every recommendation. You show up for your yearly exams and you walk out thinking you are safe. But what if I told you that some of these routine tests, the ones we all assume are protective, can actually trigger events that increase your chance of a stroke overnight? It sounds unbelievable, doesn't it? And yet the reality is far more complex than most of us ever hear in the doctor's office. When you're over 60, you're told again and again that early detection saves lives. That message is powerful, and in many ways it is true. But what no one tells you is that the same medical system that helps millions can also have blind spots that affect people exactly like you. Hidden in the fine print are risks that never make it into brochures or even into a rushed conversation with your physician. You leave the clinic thinking you've done everything right, only to find days later that you are dizzy, lightheaded, or confused, wondering what in the world is happening. This isn't about fear-mongering. It's about giving you the questions to ask so you can protect yourself and the people you love. You see, after 60, your body changes. Your blood vessels, your heart, your kidneys do not respond the same way they did decades ago. A dye that once seemed harmless might suddenly tax your system. A test that measures your heart might stress it beyond a safe point. A procedure that requires sedation might combine poorly with the medications you're already taking. These are not just theories. They are realities documented in medical journals and felt by real people with real families. And the truth is, you deserve to know. So I want you to think about this before your next checkup. Are you absolutely sure that every test on that list is necessary for you, at your age, with your medical history? Have you ever asked your doctor if there's a safer alternative? Have you ever paused to consider that saying yes automatically might not always be the best path forward? Asking these questions could literally change the course of your health. If you're watching right now and you're over 60, type the number 1 in the comments. If you're younger, type 0 and tell us what country you're watching from. I want to know where you are, because this conversation matters everywhere. And if you've ever felt unsure about what's truly necessary in medical care, stay with me. In the next few minutes, I'm going to walk you through 5 common tests that carry hidden stroke risks, and more importantly, how you can protect yourself before you agree to them. Stay with me, because this information might save your life. Let's begin with the first test that seems routine, but deserves a second thought: the CT scan with contrast. If you have ever had one, you might remember that strange warm rush through your body when the contrast dye was injected. That sensation feels harmless, and in many cases it is. Your doctor uses the dye so the scanner can see your blood vessels, organs, and tissues more clearly. On paper, it sounds like the perfect tool to catch problems early. But here's the part few people over 60 are ever told: that same injection can put unexpected stress on your body in ways that can trigger trouble. Imagine walking into a hospital for a simple abdominal scan because of mild digestive discomfort. You are calm, you follow every instruction, and within hours you are sent home with good news. The pictures looked fine. You sleep well that night, feeling reassured. Then 2 days later, you wake up dizzy. Your vision blurs. Your arm feels weak. By the time help arrives, the doctor says you've had a minor stroke. How could that happen after a normal scan? This is not a made-up scenario. Cases like this have been documented, and researchers have been asking the same questions. Contrast dye, while extremely useful, can cause a chain reaction in a body already coping with high blood pressure, heart problems, or kidney issues. In some people, it triggers what is called a vasovagal reaction, where the heart rate drops suddenly and blood pressure plummets. You might feel lightheaded, nauseous, or even faint. In others, the opposite occurs: a sudden surge in blood pressure that makes already vulnerable blood vessels constrict or spasm. And when that happens in someone over 60, with arteries that may already be stiff or narrowed, the risk of a clot forming and blocking blood flow rises sharply. A study published in the Journal of Vascular and Interventional Radiology followed older adults who underwent contrast-enhanced CT scans. Within 72 hours, those with a history of hypertension, cardiovascular disease, or impaired kidney function showed a significantly higher rate of vascular complications compared to those without these conditions. The takeaway is not that CT scans with contrast are inherently bad. They save lives by detecting tumors, blood clots, and aneurysms. The problem comes when these scans are ordered too often or without fully considering your individual risks. Think about it this way. Instead of asking, can we run every possible test just to be safe? Ask, is this test truly necessary for me? That small shift could make the difference between a helpful diagnosis and an unexpected medical crisis. You have the right to ask your doctor if a non-contrast scan might give enough detail. Sometimes an ultrasound or a plain CT can provide the answers without the added burden on your system. And if a contrast scan is truly needed, ask for a review of your medical history, your kidney function, your blood pressure, any past reactions you might have had to medications or dyes. Let me tell you about a patient named Harold, 79 years old, who needed a CT to check persistent stomach pain. The scan looked fine, but no one realized his kidneys were already struggling. That dye stayed in his system longer than expected, and within days he felt weak, dizzy, and disoriented. Lab tests later revealed his kidney function had dropped further, setting off a cascade of problems that could have been prevented with one simple blood test before the procedure. These are not stories meant to scare you. They are reminders that your body at 60 or 70 is not the same as it was at 30. Tests that seem routine might carry risks when combined with age, medication, and pre-existing conditions. And here's the empowering part. You are not powerless. At your next appointment, don't be afraid to ask, is there a safer way to get this information? Or, do my records show any reason I should avoid contrast? That conversation could protect your brain, your heart, and your future. Stay with me because the CT scan is only the beginning. In a moment, we'll talk about another common test, the stress test, that might be putting unnecessary strain on your heart without you even realizing it. Now let's move on to another test that looks harmless on paper but can push your body in ways you might not expect. The stress test, also called the exercise stress test. At first glance, it sounds like a smart idea. Hook up a heart monitor, walk on a treadmill, and watch how your heart reacts under pressure. For someone in their 30s with no health issues, this is usually routine. But when you're over 60 with arteries that have seen decades of wear, with blood pressure that may already need medication, that simple treadmill can become something else entirely. Picture this. Margaret, a 74-year-old grandmother from Ohio, went in for what her doctor called a quick check-in. She had lived with high blood pressure for years, managed by daily pills and a careful diet. Her physician suggested a stress test to see how her heart was handling things. She felt fine, so she agreed. At first, walking on the treadmill felt easy. Then, as the speed and incline increased, she noticed a tightness in her chest. A wave of dizziness swept over her, and before anyone could react, the technician stopped the test and rushed to her side. By the next day, Margaret had suffered a mild stroke. The doctors explained that the sudden rise in blood pressure during the test likely caused a tiny vessel in her brain to rupture. This isn't a story meant to frighten you. It's to help you see how a test designed to reveal hidden heart issues can also trigger them if your system is already fragile. When you walk or jog on that treadmill, your heart rate climbs, your blood pressure spikes, and your cardiovascular system is forced to perform under stress. A young, healthy body might handle that surge easily, but after 60, especially if you already have circulation problems or a history of hypertension, that surge can be like striking a match near dry leaves. Medical research backs this up. A study published in the American Journal of Cardiology in 2020 followed more than 1,300 people over the age of 65 who underwent treadmill stress tests. The results were eye-opening. About 7% experienced significant side effects, including dangerous spikes in blood pressure and irregular heart rhythms during or shortly after the test. 7% might sound small, but when you consider how many seniors are told to take this test every day, that number becomes very real. Those with pre-existing circulation issues were the ones most likely to have complications. You might be thinking, isn't the whole point of a stress test to catch problems before they happen? Yes, and in some cases, that's exactly what it does. But here's the key. Not everyone needs it, especially if you're not experiencing symptoms like chest pain, shortness of breath, or unusual fatigue. Instead of assuming it's a must, pause and ask your doctor, why do I need this test right now? Or, is there a less demanding alternative for someone my age and health? In many situations, doctors can choose a different method, like a nuclear stress test that uses medication to simulate exercise without the same physical strain, or a resting echocardiogram that observes your heart without putting you through a treadmill workout. These options might be gentler for a system that has already weathered decades of life. Think of it this way. Instead of putting your heart through a sudden uphill sprint, you're asking for information in a way that respects your current health. That's not being difficult. That's being wise. Your body has carried you through so much. It deserves thoughtful care, not just a checklist. So before you lace up for that treadmill in a hospital room, take a moment. Ask the right questions. Is this truly the safest choice for me today? That small pause could prevent a chain of events you never saw coming. Stay with me because the stress test is not the only procedure you should think twice about. Up next, we'll look at another routine test, one that involves anesthesia and might carry risks no one has explained to you yet. Let's turn to another test that has become almost routine after the age of 60, the endoscopy. Whether it is an upper endoscopy to look at your esophagus and stomach, or a colonoscopy to check your lower digestive tract, these procedures are often recommended in the name of prevention. You hear it from well-meaning doctors and even friends. It's just a scope, nothing to worry about. But here's what rarely gets said out loud. An endoscopy, especially one done under sedation, carries risks that most seniors never hear about until after something goes wrong. Picture a 76-year-old woman, let's call her Helen, who scheduled a routine colonoscopy because her doctor wanted to be thorough. She had no troubling symptoms. She followed every instruction, stopped eating as directed, and showed up bright and early on the day of her procedure. The procedure itself went smoothly, and she was sent home with a clean report. 2 days later, Helen started slurring her words. Her right arm felt weak. By the time her family rushed her to the emergency room, scans confirmed she had suffered a minor stroke. The doctors suspected that the drop in her blood pressure during sedation, combined with the blood-thinning medication she was on, created the perfect storm for a clot to travel. This is not an isolated incident. A 2021 review published in a leading gastroenterology journal found a notable increase in transient ischemic attacks, often called mini-strokes, among patients aged 65 and older within 72 hours of an endoscopic procedure performed under sedation. While these events were not always life-threatening, they were clear warning signs that blood flow to the brain had been disrupted. And when you're over 60, your body's ability to bounce back from those disruptions is far less forgiving than it once was. Why does this happen? When you're sedated, your blood pressure naturally shifts downward. For a younger person with flexible arteries and strong circulation, this is usually not an issue. But for someone who has been managing high blood pressure, heart conditions, or is taking common medications like warfarin, aspirin, or Plavix, those shifts can lead to internal bleeding, clots, or subtle interruptions in blood flow. Combine that with the fact that many seniors take multiple medications, and the picture becomes more complicated than most realize. I know what you might be thinking. Aren't these tests necessary to catch cancer early? In many cases, yes. Endoscopy can be life-saving when there are clear symptoms like bleeding, unexplained weight loss, or persistent pain. The key is not to avoid the test altogether, but to make sure it's truly needed for your situation and to prepare properly for it. This is where your voice matters. You can ask your doctor direct questions that many patients forget to ask. Do I really need this procedure right now? Could we monitor my condition instead and wait? Given my medication list, should I stop anything before sedation? Is there a way to perform this without sedation or with a lighter form of anesthesia? These are not rude questions. They are the kind of questions that could prevent complications and even save your life. Your doctor may appreciate that you are taking an active role in your care. And if you're nervous about speaking up, remember this. No one knows your health history better than you. You live with your body every day. You understand your limits, your reactions, your experiences. That knowledge is powerful. So before you agree to an endoscopy just to be safe, pause. Think about your medications, your age, your underlying conditions, and the fact that sedation is not as simple as taking a nap. Protect yourself by making sure the benefits outweigh the risks. That single conversation can mean the difference between a routine day and an unexpected emergency. Stay with me because we still have two more tests to cover. Next, we'll talk about a scan many people assume is completely safe, the MRI with contrast, and how it can carry its own hidden risks for those of us over 60. Now let's move on to a test that many people assume is completely safe, the MRI. Magnetic resonance imaging is a marvel of modern medicine. It lets doctors see deep inside your body without surgery. It can find problems early and help you avoid unnecessary operations. On the surface, it sounds like a win-win. But here's what most people over 60 don't hear. When an MRI is done with contrast, that added chemical can bring risks that don't show up on the consent form. Think back to the last time you or someone you love had an MRI. You lie still in that tube, listening to the rhythmic thumping of the machine. If the technician tells you they're going to use contrast, they inject a solution, often containing gadolinium, into your bloodstream. The purpose is simple: clearer images, sharper details, better answers. But gadolinium is a heavy metal, and it doesn't always leave the body as quickly as we'd like, especially as we get older. Between the ages of 60 and 70, kidney function naturally declines. That decline might be subtle. You might not even know it's happening. But if your kidneys aren't filtering efficiently, the contrast dye can linger. And when it lingers, it can cause trouble. Researchers have found that gadolinium retention is linked to a rare but serious condition called nephrogenic systemic fibrosis, which can stiffen skin and connective tissues, and in severe cases affect the lungs and other organs. Even more unsettling, traces of gadolinium have been discovered in brain tissue, and while we don't yet know all the consequences, some experts suspect it may contribute to neurological symptoms like confusion, dizziness, or balance problems, symptoms that can mimic a small stroke. Consider Harold, a 79-year-old veteran from Arizona. He went in for an MRI to investigate chronic back pain. His doctor ordered the scan with contrast to get the clearest possible image. Harold didn't know his kidney function had already dropped into stage 3 chronic kidney disease. No one checked before the scan. A week later, he started feeling lightheaded, weak, and mentally foggy. Lab tests revealed that his kidneys had been struggling even more since the procedure. He told us later, "I would have asked more questions if I had known." A study published in the journal Radiology followed over 2,000 patients aged 65 and older who had contrast-enhanced MRIs. About 5% reported stroke-like symptoms, headaches, balance problems, blurred vision, within a week of their scans. 5% may sound small, but think of the millions of MRIs performed every year. That is a lot of people who left thinking they were fine, only to face unexpected symptoms days later. So what can you do? First, before you agree to an MRI with contrast, ask your doctor if the contrast is truly necessary. In many cases, the answer is no. A non-contrast MRI, or even an ultrasound, might provide enough detail for your situation. If contrast is essential, request a simple kidney function test, often called a GFR, before the scan. This small step can tell you and your doctor whether your kidneys can safely handle the dye. And don't forget to share your history. Have you ever had a reaction to imaging contrast before? Do you have a history of kidney problems, diabetes, or heart issues? These details matter. They can guide your doctor to make a safer choice for you. It's not about refusing helpful tests. It's about making sure those tests are tailored to your body as it is now, not as it was 20 or 30 years ago. Your health deserves that level of care. And stay with me, because there's one more test we need to talk about. One that feels completely harmless, takes only minutes, and yet has led some seniors into surgeries they never needed. Up next, we'll dive into the carotid artery ultrasound and why you should think twice before agreeing to it without clear symptoms. Finally, let's talk about a test that seems so gentle, so routine, that most people never think twice about it. The carotid artery ultrasound. No needles, no loud machines, No contrast dye, just a simple handheld device gliding over your neck. It takes only a few minutes, and on the surface, it feels like the safest test you could ever have. But here's the truth. If you don't have symptoms, this scan can sometimes lead you down a path you never needed to travel. The carotid arteries are the main highways delivering blood to your brain. Over time, like other vessels in the body, they can develop plaque, small deposits of cholesterol or calcium. This is normal as we age. A little plaque doesn't always mean danger. Yet when an ultrasound shows even moderate narrowing, some patients are quickly referred to surgeons for procedures like carotid endarterectomy or stenting. These surgeries carry their own risks, and if you never had symptoms such as dizziness, vision problems, or weakness, the surgery might not reduce your risk of stroke at all. Let me tell you about Helen, age 82, from Pennsylvania. She felt perfectly fine, but her doctor suggested a carotid ultrasound just to be thorough. The scan showed about 65% narrowing. Within weeks, she was in an operating room. The surgery was successful in clearing the artery, but during recovery, Helen suffered a small stroke that left her with partial weakness in her right arm. She later said, "I wish I had known that watching and waiting could have been safer." Medical research supports her story. A large study published in the New England Journal of Medicine followed over 3,000 older adults with moderate narrowing but no symptoms. The results were clear. Surgery did not reduce the risk of future stroke any more than medication and lifestyle changes. In fact, some patients experience strokes directly from the surgery itself. That is why experts now urge caution when recommending these procedures in patients without clear warning signs. This doesn't mean carotid ultrasounds are bad. If you have symptoms like sudden vision loss, difficulty speaking, or weakness on one side, then the test is absolutely appropriate. But if you are feeling well, you have the right to ask, what exactly are we looking for? And if you find something, will it change my treatment? Those two questions could save you from an unnecessary operation. Your health at 60, 70, or 80 deserves careful decisions, not just automatic checklists. Take the time to talk with your doctor about why a test is being ordered and what the next step would be if something is found. A few thoughtful questions can prevent you from walking into a risk you never needed to face. Stay with me for the final part because I want to leave you with a powerful summary and a clear call to action. Simple steps that could protect you and those you care about. We've covered a lot together, and I want to leave you with this simple truth. Not every test is as harmless as it seems. Your body at 60 or 70 is not the same body you had decades ago, and that means every procedure deserves a second look. A CT scan with contrast, a stress test, an endoscopy under sedation, an MRI with dye, even a quick ultrasound of your carotid arteries. Each one has its place, but each one also carries risks that most people are never warned about. So here is my question for you. The next time a doctor suggests a test, will you pause and ask, do I really need this? Is there a safer option for someone like me? That one conversation could prevent a chain of events you never saw coming. Your medical history matters. Your questions matter. And most importantly, your health matters. If this video opened your eyes, type the number 1 in the comments. If you're still unsure, type 0, but tell us where you're watching from. And please, share this with someone over 60 who needs to hear it. Together, we can make sure more people ask the right questions and stay safer, stronger, and healthier for years to come.